Hello, this is Anne DeGheest. Welcome to the YouTube channel called Anne Insights. These are apolitical and science-based updates on COVID. This week is really critical. In the last 2 weeks, I was able to attend several webinars with some of the thought leaders on infection control and vaccine. And I am summarizing this information in 2 videos. One is showing the upsurge in the US and the fact that Europe is now having a second wave that's higher than the first one. And the second video is something you don't want to miss. I'm talking about how can you build your immune system and your own resilience program. And then number 2, what does it mean to have an effective vaccine that's approved? And do you still have a 50 to 70% chance of being infected? I need your help. I really want you to help me spread the word and this knowledge. The next 4 weeks to 6 weeks are going to be critical in the US to stop the surge that is happening so we don't have the same problem that's happening in Europe. So please help me, give me a thumbs up and share these videos. Let me now share my screen and let's start with the first or the second video. Hello, this is Anne DeGheest, and this is the first video on the epidemiology. So what is happening? A lot. And unfortunately, not what we wanted to hear. You can see Europe. Look at Europe. This is where they were in the spring, in the red color there. And we are basically 2 to 3x higher rate than what we had in the spring. That's very worrisome because this is what we were all afraid of, the famous second wave coming up in the fall. Now, if you look at America, which is the brown color here, you can see we are also having a major upsurge. And we'll talk about half the states are going straight back up, some of them at 50 to 75% in the last 2 weeks. There's some good news, South America, some of the states are going down, some are going up, and India is going down. So we're losing control. We're losing control with a major Midwest surge, but what's very worrisome, some of the Northeast now is having a surge. So we'll talk more about that. Russia, most of the countries in the EU and Israel are having a major second wave. The death rate now, we have passed the million number of deaths worldwide, 212,000 in the US. There is 36 million people in the world that have been infected. And these are the confirmed case. Remember, we think the ratio of confirmed versus non-confirmed could be 5 to 10x. So this is really a global pandemic. You don't want to miss my second video. Please check on YouTube. I'm going to be talking about what is it to be an effective vaccine? What's the definition of that? And you're still at risk of a 50 to 70% chance of being infected based on the definition to be approved by the FDA. So we'll do a deep dive on that. And you don't want to miss the program that I got from the military about how can you build your immune personal resilience programs. What are the things you can do to really help protect yourself? So let's talk about the specifics. You can see the world, unfortunately, is continuously to grow. This is really worrisome. This is an average on the daily basis. We now are 350,000 daily cases worldwide. And these are, again, I repeat, reported and confirmed case. The reality is probably higher than that. So on a worldwide basis, we are not slowing down. We're on a steady growth, unfortunately, in a number of daily cases. That means there's 36.6 million cases. The US is leading with 7.6 million, but look at India. They're close to 7 million. They are going to pass us, although they are slowing down. And Brazil is at 5 million, and Russia has also had a major upsurge at 1.2 million cases, which means that we are the leader in the world in the death at 213,000 deaths in the world, followed by Brazil at 148,000. India, ironically, has a lower fatality rate, and that may be because they have a younger population that gets infected. So the US data is a little bit weird. I got different sources for what happened yesterday, and it's between 47 to 56,000 cases happened on October the 8th. And what's very strange is that it comes from official government sources. But the bad news is that we were at 34,000 a few weeks ago. That means we've had a major increase in the number of cases in the US. Now, the good news, we're still below the peak that we were over here, which is around 70,000 there. But it's very worrisome that we still don't get control of that first wave. And every time we get better, we get complacent and boom, it goes straight back up. And we're entering the fall, which means people going indoor, cold the temperature, which we all know should bring it up. So, going backwards. The India is reporting lower cases, so maybe they're getting under control. And unfortunately, the hotspot may be moving back to the US, which is clearly at stop. It's decreased and it's going back up. So we're having an upsurge. South America is also going back up. Argentina and Mexico and Brazil, which was also slowing down, has stabilized and is going to go back up again. Europe is really worrisome. Look at this graphic. This was the peak. This was the peak, remember? In Spain was the worst, followed by Italy. Look where they are today. France is 3 times higher than what they were in the spring. And all these other countries are, most of them are going higher. Even some of the countries that had some control, like Belgium and Switzerland, you can see it, everything is going back up. Very, very worrisome. The positive rate, as you would expect, is going back up. This is Ukraine, it's at 20%. The Netherlands, which was a little bit like Sweden practicing the herd immunity, is back up to over 13% there. And you can see Belgium is doing some more lockdown there because they're going back up again. So we need to keep an eye on that because this may be what's coming to the US in the coming weeks. So Russia is now at an infection rate that was higher than in May when they had that big surge, and it's pretty vertical there. The UK has a similar problem, significantly higher than the peak that they had by 3x. So they were at 5,000 daily new cases, now they're at 15,000, and Spain is also going up. And in fact, they just have a state of emergency in Madrid. So, the Netherlands, this is when school reopened. And you're going to see there's a pattern there in a lot of this surge is tied to the school reopening there. So the Netherlands went straight back up. And this is one of the European countries there that was not really enforcing mask and control. They were a bit of a Swedish approach. Belgium is going back up. Germany is going back up. And France is at 3 times the peak in cases per day. Paris has over 40% of the ICU beds that are now occupied by COVID patients. They have now started what's called the top COVID alert level, which means they're postponing elective surgery. They're recalling people back from vacations in the healthcare system. The bars and the cafe have been shut down for the next 2 weeks, and they've limited the gathering to 10 people maximum. Similar things happening in Belgium. Israel is a very interesting story. They had that control of the virus during July, and then the Orthodox schools reopened, and then the general schools reopened. And there's a very big concern there because clearly the Orthodox population were not willing to follow some of the guidelines for safety there, and they triggered that major outbreak. And you see here, if you look at the young people, which are in blue, which is the men between 18 to 21 years old, you can see there was this massive upsurge in positivity rate that went from 5% to 25%. And then, of course, as you would expect, it then triggered with some delay the older population, the 30 to 60 years old, and then the elderly. So it went from the kids to the parents to the grandparents. And so the lessons that we can see from what happened in Israel is that the school reopening should not happen if your infection rate, which is the R now, is very high, that a young outbreak will end up reaching the elderly within a matter of several weeks, that a local outbreak will spread to other cities around it, and that the behavior of one subgroup will contaminate the rest of the population. And in this case, the Orthodox group is 12% of the population, but they are now 45% of the cases. What's happening also in Europe right now is that although they have a high infection rate, the mortality rate is still low, but it's unclear if it's that a mutation of the virus, which was reported in Marseille, that they saw a different mutation of the virus there, but it is the same person that was talking about hydroxychloroquine, so it's a little bit controversial. And or is it just that delay that we saw in Israel, where it takes 1 to 2 months to get to the elder population who is at a higher risk? You can see that in Europe, in this graphic there, that it's all over the places in the willingness of people about wearing a mask. Clearly, in the northern country in Russia, a low percent of the population is wearing it. The country that got hit really hard, which is like Spain, for example, you can see that the high percent of the population, remember in Madrid is pretty much in a shutdown situation right now. And France is also putting a lot of mandates. So you can see the area there that's being hit really hard, that having that upsurge. But other countries, like Holland, for example, there, which had this big upsurge there, they were not wearing masks. So there's clearly a relationship between wearing a mask and having that second surge. So let's talk about the US. We are losing control again. We never had control. We tried to get it under control over the summer. We thought that the summer and the heat and all of that took care of it. We started being complacent, and it's going straight back up. And it's extremely worrisome because 6 states have had an increase of over 50% in the last week. And I'll show you some more data about 2 weeks. 22 states have had 10 to 50% increase. This is a significant increase. And it's clearly the Midwest, but this is worrisome. The Northeast is basically coming back up again. Let's look at the dashboard. We have gone from 2 weeks ago from 300,000 cases per week to 323,000 cases a week. So we're accelerating back up. And you can see that we are at 7.5 million cases and over 212,000 deaths. Let's do a bit deeper dive. 41 states are into a spreading situation there. This is a government website that keeps track based on multiple index about who is having control of their population. You can say, you see, most of the states have now lost control of the spread, and 13 states have a positive rate over 10%. Let's talk about North Dakota. In North Dakota, you can see how quickly it went. You know, they were pretty much steady heading until July, and then it exploded. You can see it going straight back up. And so they're now one of the highest infection rate per million, which is around 564 daily cases per million there. And so if you look state by state, and they put all of them because there's too many of them, but here the one we were in. New York went up 72%. That is not good because that's a very dense population. Massachusetts went up 53% in the last 2 weeks. New Jersey, 43%. North Carolina, 43%. And you can look at all the other states. They're still all very high in the percentage. I just picked the one with a very high population. So this is very worrisome. And I really need your help to please spread the knowledge there. We need to control this in the next 4 to 6 weeks. It's still the second leading cause of death on a weekly basis. It's just being followed by ischemic heart diseases, which is pretty much heart attacks. And that's going to stay there for a while. Hopefully it doesn't become number one in the winter. We are very far from the herd immunity. This is the status of the percent of the population that has been infected. And this is the confirmed case plus the estimate of what part of the population has not been confirmed but could be infected. And you can see that clearly New York, New Jersey got hit really hard in the spring, so they have a high percentage there. But the rest of the country, it's less than 5 to 10%. So we have a lot of room to go as far as spreading that virus in the next 4 to 6 months. So as a result of that, this is the Healthcare Institute that's being used by the government to do their forecast. And they have 3 scenarios. One scenario is that if we do a mandate of the mask, which is the light green, what's the mortality going to be by the end of the year? And if we basically ease up, which I think is what a lot of the states are doing, and they expect 400,000 deaths by the end of the year, i.e. doubling the number of deaths. And I've heard this number from Dr. Fauci and Dr. Redfield. I mean, it's pretty much all the specialists. This is their expectation by the end of the year. And remember, the end of the year doesn't stop there. We still have January, February, and March, which is still part of the winter. So we could have a significant death coming at us. Their expectation of what's the infection rate by January the 1st of 2021, you can still see that, California may have like a 13% infection rate there, but the Southeast is going to take a hit. And the New York, New Jersey, which is consistent to what we've seen in the last couple of weeks, that the high density population there, are going to be seriously affected by the next infection. Number of daily cases, we've seen is like, this is reporting 56,000. This is a CDC report, which is significantly higher because we were at 34,000 a few weeks ago. So clearly going straight back up. And if you remember this graphic there, which has the most daily cases, which is based on the population size, and that's what you want to do. And basically in orange and in red is anything above 10 cases per 100,000 there. Most of the Midwest now has fully lightened up, the whole country. It used to be this area there was green. And now you can see the Northeast now is unfortunately having an upsurge. The hotspot is shifting around every 2 weeks. I show this graphic there. These are different numbers. We started here in the spring. It went up south, and then we went to the southeast, and then went to south and California, and now it's the whole Midwest. The whole country is going for it. The vaccine has no border. The positive rate is still at 8%, but look at this number on the right side here. Florida, between 11 to 20% of the people tested are positive. Texas, Virginia, these are all big states. And you can see that although they're doing a lot of testing, then we're still under testing, so the virus is still spreading in the community. Long-term care, we are not realizing, but people in long-term care are 1% of the US population, but they are 41% of the death. And it is an area that we absolutely need to step up. We need to do better testing at the point of care, and we need to really be much more active in protecting the elderly population in long-term care. These are high-density, indoor, kind of the worst cases as far as transmission infection. The death by age group kind of explains that. You can see most of the mortality as a percent of the death rate are people over the age of 70. But remember, people in the middle age group there, they still have quite a significant mortality risk. California, unfortunately, is at 840,000 cases. So we're like climbing. It's not as bad as the other states. So we have some growth, but not as bad. It's still the Latino population is 61% of the cases, and the young people, this number has been growing up, over the last summer. They're around 60%. The 18 to 49 years old, the same thing we saw in Europe and Israel. These other people are basically getting infected, and they are passing it on to older people there. Unfortunately, that's what drives some of the mortality rate. This is an interesting story, which is how do we find enough bed for people in the ICU? And there is this place called Imperial Country, which is on the San Diego side, close to Mexico. And they don't have enough ICU beds. So they had to literally transfer 500 patients. When we had in the summer there, you can see the area there between June and August there. And they literally had to get them not only to San Diego downtown, which makes sense, but all the way to San Francisco. And it turns out there is no integrated data system where you can find availability of an ICU bed. We are like in the dark ages still in trying to identify there. So the poor nurses had to do an average of 40 phone calls across the state to try to find an ICU bed and then transfer people by helicopter, ambulance, and other ways so that they could get the ICU care they needed. Another interesting story is what happened in North Carolina. They could not get remdesivir. And if you remember, we changed the system there where people reporting to the CDC, to the HHS and the White House system there. They did enter the data, but there was a glitch, so something went wrong, and there was no data entered into the White House, so they got no allocation of remdesivir. And so we have all this, unfortunately, story that kind of aggravates what's already a difficult situation there. So Dr. Birx, that is part of the White House task force and used to be an ambassador for the Global AIDS Coordination, basically said it's easier to get data from HIV clinics in Africa than in the US hospital data system. And that is unfortunately a very sad story to tell. So the COVID death is so far the 200,000 cases. It's more than the last 5 years of flu combined. I mean, I can't believe I still have to explain that this is not the flu. This is significantly worse than the flu. So this is what the CDC has reported in last year. There were 22,000 deaths in the 2018 to 2019, 2019 to 2020 flu season there. And we basically are significantly higher than that. And also, COVID is much more contagious. It's between 2 to 3 people get contaminated when you're infected versus the flu is just 1.2 ratio. What that means is that since this is exponential, there is that if one person here is infected, there you can see after a few generations, you end up with certain contamination. Compare that to the number of infection you can see with COVID. So although it looks like 1.2 versus 2.5 is not a big deal, when you start multiplying this, it becomes catastrophic. So I want to repeat it again. COVID is significantly more fatal than the flu. So face covering policies is all over the places in the US. In darker blue is the stronger requirement there. And of course, that ties to what people are wearing. Not a surprise. You can see that pretty much the whole Midwest, which is where we're having that surge there, has the lowest incidence of people wearing a mask. And then, of course, as you would expect, Texas and Florida, that got hit really hard during the summer there, have a higher percentage of people wearing it, as well as New York. Whoops. a bit of a delay here. Let's talk about the economics. This is data that came from the Washington Post that show that we have recovered around 50% of the jobs that have been lost. So we have had a good recovery of the economy, but it seems to have been different depending on the demographics. So the Black Americans have only recovered a third of the job that they lost, as opposed to around 50% for the rest of the population. The lowest wage, so this is mostly people in the service industry, like the restaurants and all of that, they have had a significantly drop, over 30% drop, and haven't fully recovered, where the highest earning are the ones that are recovering the fastest there. It has had an impact on real estate. So for example, in San Francisco, the monthly rent has dropped close to 18%, because there's no reason not to be in a high density city. I mean, you can work remotely from anywhere. San Jose has dropped close to 10%, and so and 8% in Oakland. But this is not the only place. Some of the largest cities, 41 of the 100 largest cities have had a drop in their rental. New York, 11%, Seattle 10%, and Washington 8%. And then people are moving to different locations. So there has been a rise in Las Vegas and Boise, Idaho, and Reno, Nevada there. So interesting to watch. And of course, it's all the things you would expect. You know, some of the service workers have been hit the hardest. And of course, they left the big cities because they can afford it. And remote work, you don't have to be near your office anymore. You can be anywhere. So please vote. This is a 102-year-old person there that had a special PPE equipment there with a remote negative air, all of that done by her grandson. She's been voting since 1940, and she said this year is going to be the most important election of her year. So please vote. Take appropriate action. I don't know if you have to get to that level of precaution there. Please vote in the coming weeks and be safe. Please take a look at my second video, which is going to be going a deep dive on the clinical and how you can improve your immune system resilience against COVID, as well as what does it mean to have an approved effective vaccine.